Good to go.
Great. Welcome all to the September 20th meeting of the Citizen Oversight Board. Thank you for accommodating a small schedule change. And Sheriff Diggins, we're glad to be meeting with you today. If we can quickly go through board business, because I know we're starting a little bit late. The first thing is that we are still waiting to fill out our board. We're waiting on the mayor's office for a nominee there, and reminding the community that it's always an opportunity to apply. I'd like to call for approval of the board's minutes from our September 6th meeting. I may have a motion to do so.
So moved.
I see Rufina seconded. All in favor, aye?
Aye.
Any opposed? I think there's a lot of folks who are on mute still, board members, so perhaps come off mute just to say aye, make sure we've got appropriate approval there. Karen, Tamisha, and David, I know you're on mute. Can we take that vote again? All in favor, aye?
Aye.
Thank you. Just want to make sure we're doing the process. Perfect. Next, we had planned for an October 4th celebration of the 20th anniversary of the creation of the Citizen Oversight Board and the Monitor's Office. We are going to delay that slightly due to the availability of participants, so folks can look out for a celebration in the new year. Additionally, we know that the city is going through some budgeting processes right now, and there is pressure on the Monitor's Office to hold on a position, which the board is not in favor of. We want the Monitor's Office to be fully staffed, so we'll engage in further conversations in the future on that matter. Lastly, Daniel, am I missing any board items? Okay. We'll move forward. We have selected a partner to help us with strategic planning. Thank you, Rufina and Larry, for processing through that. I think we've got a great support there, and they'll begin working with our team as soon as we get the PO signed. So that will happen in the November timeframe, and look forward to everyone's thoughts and participation in our strategic planning. Okay, with that, we're joined by Sheriff Diggins today. And while we provided the sheriff some questions in advance, Sheriff, I know there was a death in custody yesterday, so I'm wondering if we could perhaps start with what you can share regarding that matter.
Yes, Madam Chair, good morning to the board. It's always good to see you all and to chat with you. If you don't mind, I'd like to begin by just thanking the men and women of the Denver Sheriff's Department who do a phenomenal job of serving the citizens of the city and county of Denver every day. Show up 24 hours, 7 days a week. Regarding the death in custody yesterday, it happened at the downtown detention center. In one of the pods, a medical emergency was called by a deputy in the pod, who then began to ensure that the pod was under control and began to ensure that life-saving measures were started. Those were continued for quite some time by Denver Health medical staff, as well as Denver paramedics and EMTs with the fire department. Unfortunately, the gentleman did not survive. We certainly understand how this is tragic for his family, so we want to send our deepest condolences out to his family and friends. We also have checked on our staff because it impacts them, and we also checked on the people in custody and had mental health specialists work with our staff as well as the people in custody after the incident. As you might expect with something that happens of this nature in our facility, it is under investigation by the Denver Police Department. They did come in yesterday and begin an investigation, and will continue to do so until their investigation is complete.
Thanks. Do you happen to know typically how long that takes? I suppose it's driven a little bit by the complexity of the incident, but how long might the community expect to wait?
As you stated, Madam Chair, it does depend on the complexity of the review by the medical examiner's office, as well as the investigation by the Denver Police Department. So the times vary about how soon an outcome can be shared regarding what happened.
Good morning, Sheriff. This is Alfredo. Thank you for what you do for the city and the sheriff's staff day in, day out. I'm wondering, is there anything you could share that led up to the incident or in the moments before? Was this an issue among inmates? Anything you can share about the moments leading up to it?
What I can share is that we believe this was primarily medically related, and without tainting the investigation by the police department, I will refrain from sharing anything else.
Understood. Thank you, Sheriff.
Thank you, sir.
Okay, other questions from board members on this topic? Okay, Sheriff, we had sent a couple of questions in advance. I've got a couple more that I'd like to ask as well, but if you wouldn't mind reading the question that we provided you and answering, that would be great.
Thank you, ma'am. I'll start with question 1. Last year, you told us that you hope to implement a new electronic health record system in 2024. Where does that project stand, and when do you anticipate transitioning away from paper medical records? We continue to work with the vendor to finalize the service level agreement, and the statement of work has been sent over to the contracting office for the city for review. We've also been working on a technical architecture review to present assumptions and plans, and also plan to present at the next technical architecture review committee meeting for final approval. The project status for the overall project is in the green section, which means it's going well, as are the schedule, the budget, the scope, and the resources that are attributed to it. As this is a massive project and a massive change for us, we want to make sure that this is done right. It is progressing in the right direction. We have a lot of support from the Director of Safety's office, from the Budget and Management office, from Technology Services inside the city. And we're also working directly with Denver Health as we begin the transition. So we look forward to a time where we have an EHR for the Sheriff's Department, and perhaps can know who someone is as soon as they arrive at our door medically. And when they transition back to the community, we can share those records electronically, either with Denver Health or other providers, to ensure that there's a good continuity of care medically for people as they go back home. Madam Chair, I'll stop there for questions.
Yeah, so I, having been in the systems implementation business for a long time, these are typically multi-year projects. Can you just sort of talk about sort of where you are in the process, right? Typically there's some business process design. I imagine in an EHR, you're doing, you know, making the actual physical paper records electronic. There's system configuration, right? There's training. Like at what sort of part of this are you in?
You hit the nail on the head, ma'am. It's a multi-year project. At the current state, the statement of work is still being worked through and being approved. And as the technical architectural review is being done, it will give us guidance on how that transition is to occur in standing up the system and also marrying it to the system that Denver Health has. Once that is complete, then we'll begin the process of scanning in documents and inputting information for the folks that come into our custody. For us, sometimes it's challenging, as you all could imagine, and Madam Chair, you can attest to this. We're building a plane while we're still flying. So we have to input historical records and archive records, but also continue to create records for folks that are in our custody as well. We book 23,000 people through our system each year. And so this is a significant project.
Questions from the board on that? And so one more question is, can you remind me, so Denver Health obviously has their own electronic health records system, which is for their business. And then this will be the sheriff's department. And then like sort of what's the sharing of information that goes between, or obviously they have access to it, but it's your EHR or
The statement of work will define the relationship and who has access to those records, as Denver Health is our service provider. They do have input on who the vendor is, and those records will have to match, or the systems will have to be able to speak to each other from the work that's being done in the jail to the work that's being done out in the community, with Denver Health being the primary provider in the community. We want to ensure that those records are capable of communicating with each other. And so we, as an administrative team, also have access to those records, but they'll primarily be, the information will primarily be put in by Denver Health staff.
thanks.
If we're seeing no other questions, I'll go to question 2. We've previously discussed and recommended creating a public dashboard with metrics related to Denver Health's performance in the jails. Our understanding was that this was something that would be done by the new administrative position that was filled last year. Do you still plan to create a public performance dashboard? I believe a lot of the board members met our new jail medical administrator, Mrs. Ronnie Brown, when we came to the county jail. And she's done an excellent job on taking on this new position that we created. Since onboarding, she's begun the process of working side by side with Denver Health personnel to understand their complete operation in regard to the work that they do with the Denver Sheriff's Department. She's helped lead a continuous quality improvement meeting and utilization management meeting schedule, working side by side with Denver Health, and to also return those meetings to being in person. She's also helping us to review, update, and become involved with the changes to the Denver Sheriff's Department's portion of the operating agreement. We've also had some internal meetings among city personnel to review the services, costs, and charges we've incurred in our contract with Denver Health. Those meetings have included personnel from the Sheriff's Department, the Director of Safety's office, and the Budget and Management office. And as we move forward to refine those metrics, we do plan to stand up a public-facing dashboard relative to Denver Health's performance and hope to have that up by the end of this year. Madam Chair, I'll stand for questions.
Great. Can you say the timing of that? I didn't quite hear. By the end of this year?
We hope that it's going to be stood up by the end of this year. As you can imagine, she had a lot of work when she got here.
Yes.
Actually done a 5-year look back and
Great.
seeing how trends have gone, seeing how costs have increased, how expenses have been based on the many different factors that we deal with. And we also have to throw in the caveat of COVID during all of that as well. So the work has been tremendous. She's done a great job. And we do look forward to standing up that public-facing dashboard, because we know that the public wants to see what's going on with Denver Health, with the work they're doing for us, which, by the way, I'll tell you all is still very good. The work that they do here is still good.
Great. Just for those folks who may just be tuning in or new board members, this has been something that has been a great focus of the Citizen Oversight Board for a number of reasons. The first of which, we rely on Denver Health to be providing medical care in the jails. The process of making complaints about that care has been fairly opaque to date. And so, people in custody of the city do not necessarily have a choice of healthcare providers. And so the quality of that care is really important, and ensuring that kind of things that are problems are fixed over time, rather than sort of just existing as problems over and over with inmates. And we, have received some direct community feedback about challenges with care, in particular, in recent years related to medicated assisted therapy and sort of handoffs between different providers, et cetera. So this, I think, is really great. And I just want to say, nice job in moving this forward, and look very much forward to looking at the dashboard. The goal here is not just to sort of say what's happening, but actually start to address problems. And so hearing you say that we're beginning to look at that as well. And I know you have said in the past, you're always looking at those problems, but for the community to actually be aware of sort of where challenges exist, and then hold folks accountable, I think is obviously very important to this board. Any questions or comments from the board on this topic? Perhaps in a future meeting, we can get an early glimpse at that dashboard too. I would love to sort of see how that's shaping up. Rufina, go ahead.
Yeah, that was going to be my question, was when could we see some, at least preliminary view of the dashboard, and what kinds of things are we able to discern from that?
I'd be happy to share the draft of that with you all, and to also perhaps ask if there are some things that you believe would be important to the community that we didn't think about as well.
And I think in one of our reports, we had suggested at least a couple of areas of particular interest to the board, but I am forgetting those. Daniel, maybe you can remember.
Madam Chair, I'm not sure if this has happened with everyone, but your sound has
I
dropped.
couldn't hear you very well.
Oh, okay.
There we go.
How about now? I'll just talk really loud in my office. Thanks. Sounds good. I was saying that I think in our previous annual reports, we have made recommendations on a couple of areas to look at, but now those areas are escaping me. So maybe we'll follow up with just an email about what might be included. Okay, great. So that, I think, was the only two questions that we provided to you in advance. Another question that I have is about overdoses. We've had previous conversations about the increase in suspected drug overdoses within the jail, ours and around the country. We know that you've taken steps to combat that, both in the introduction of drugs and contraband. And can you talk to us a little bit about any changes you have seen?
Absolutely. We stood up a task force, which is titled the Prevention, Detection, and Prosecution Task Force. That includes members of the Denver Sheriff's Department, the Denver Police Department, the Denver District Attorney's Office, the Office of the Independent Monitor, the Denver Crime Lab, and some federal partners, as well, as we took a proactive approach to the challenge that has become the #2 problem for jails and prisons across America, second only to recruitment and retention. Through the work of our staff, we have increased the work when it comes to prevention and detection by standing up body scanners at both the downtown detention center as well as the county jail. Those body scanners are airport grade material, or they perform at an airport grade level, meaning that they can scan a person's body and see everything that would be on or sometimes even secreted in a person's body as well. And through that, we have been able to discover times where folks may have contraband on their person and taken steps to improve safety and security in our facilities. We've also increased the rounds that are being done by our canines to detect contraband throughout our facilities. We've increased the deployment of our emergency response unit, which has been doing searches, which we call shakedowns, to detect contraband. And we've also moved forward with making requests for devices that can help us to detect contraband in our facilities, as well as some other things that we believe are going to continue to help us to do what we have seen, which is reduce the incidence of contraband being in the Denver Sheriff's Department's jails. What we have seen from those efforts is a decrease in the number of times where we've discovered contraband or where we've had to deploy a Narcan. And I believe the independent monitor's office can attest to this, that those numbers have significantly dropped over the past few months. I knock on wood in saying that, but we continue to work towards making our facilities as safe as possible. Madam Chair, I will pause there for questions from the board.
Questions from members on this topic?
Will that be something that you'll be measuring in the dashboard, or would that just be a report that we would be provided with in terms of the difference in the rate of either confiscating or unfortunate overdoses that we've had to deal with?
Ms. Hernandez, we do not have a public-facing dashboard, but we do have an internal-facing dashboard that the independent monitor's office does have access to. And in fact, Liz Castle and I have had an opportunity to review that information and to refine it as well. So we keep that as an internal dashboard, and we are happy to talk about some of those measures, perhaps in an executive session with the board, if the board wishes to.
Thank you, Sheriff. Unless there are other questions about that, I had a question on a completely different issue. I know that in the past you've been proud of the new contact visitation space that's been created, which we applaud as well. We're just wondering, how many people, do you have any statistics about how many people are using that, have used that visitation space since it became available? Is it, do you feel it's being used at full capacity? You plan to expand it by adding additional visitation hours? And what feedback have you received about the new visitation space, either from people in custody or family or friend visits and the likes of that? So I know there's like 4 questions in there. Take them however you want.
I'll try to remember them all, Mr. Stein.
I'll help you. I'll help you. Thank you, Sheriff.
It has been a positive change to visitation that we provide for the people that are in our custody. We've had video visitation only since 2005, and we are the only jail in Colorado which has transitioned back to adding in an in-person visitation model, which is something that we're very proud of. It has gone very well, and we have visitors coming in every weekend on Fridays and Saturdays between the hours of noon and 4. And as we've begun to refine the program, we're seeing that we're able to add more visits to the calendar with people utilizing it. We've gotten positive compliments back from the community that is able to come out and visit. And as we're able to grow our staffing, which we're working hard on, we'll be able to add more hours because of our staffing levels at the moment. We will keep the hours and the days that we have, but when we can have more deputies to be able to run the program, we certainly would like to offer that to more folks that are in our custody.
Are you turning people away that come during the visitation hours on those 2 days, or is there still room for people to visit on those 2 days? What are you seeing?
But they're pre-scheduled, so folks actually have to make arrangements to come in.
I see. Okay. And the people that are pre-scheduling them, I mean, has that filled the space to capacity generally on those couple of days during those hours or not?
It varies. I'd be happy to get some additional information about the number of visits and the times, but I don't have that in front of me now, but I certainly can get that information.
Understood. All right. Thank you.
Thanks, that'd be helpful. Another question I have is about the budget processes. We were just talking about some pressures on the monitor's office. Of course, the police department in the current version of the budget has been authorized to have more than 100 additional deputies, I believe. And I think in your initial budget description, it shows the elimination of 7 mental health positions, including 6 therapists. Can you talk about the changes that are proposed in that budget and what they might signal?
Sure, Madam Chair. Do you want me to talk about the recruit numbers? Because I believe you referred to the police officer.
I did. I was saying that it looks like the police department is getting to add, but you're perhaps being asked to remove. Sorry. Yes, that was the parallel, but bad suggestion on my part.
Got it. Thank you for the clarification. We actually have between 60 and 80 deputies that have been budgeted for our academy for 2025. And I say between 60 and 80 because we actually plan to go above that with a commitment from the budget office that we will be able to fill as many seats as possible. We've had a tremendous increase in the number of deputy recruits that are entering our academy in 2024. In fact, about a year ago, we had academy numbers that were as low as less than 10 in an academy, and it was hard to see that. We now have between 30 and 35 deputies that are graduating from our academies, which has been tremendous. In fact, Mr. Van Scooten was present last week at our graduation, as was Monitor Castle, where we had 34 brand new deputy sheriffs who were sworn in. It was tremendous to see. In fact, we've had so many people in our academy that we have to now move to a new location because we can't accommodate it with the Denver Sheriff Department facilities, which that's a good problem to have. We have another academy that is in right now in class that graduates in a few weeks that has 36 deputies. And in our upcoming December academy, we hope to have 50 new deputies. So the Budget and Management Office, the Mayor's Office, the Department of Safety, are all in support of us adding more deputies to our ranks, and we have the financial support. I actually have my budget hearing today at 3 o'clock. So folks said I pulled the short straw. I have my COB meeting at 11 o'clock and my city council meeting at 3 o'clock. I just got to drink more Celsius today. That's what that means.
Exactly, have a snack.
Yes.
Okay.
In relation to the mental health positions that you were referring to, across the city, all agencies were asked to hold open positions to help out with the budget. Many hands make for light work, and we all are contributing to holding open some positions in our agencies to help with the budget challenges that are happening. You began by talking about a position that the monitor's office is being asked to hold open. Every city agency was asked to do the same thing. We have offered up various positions inside the Denver Sheriff's Department that we do not believe will have significant impact to our overall operation. We still have our crisis response team, and you may remember that we proposed a mental health intake team, which would be separate and apart from the crisis response team. That is a part of that savings because those folks haven't been hired yet. We haven't given the dollars, and so we wanted to hold those positions open. So we're continuing to do the good work of helping people that have mental health challenges in our agency. Dr. Nikki Johnson, the Chief of Mental Health Services, and the crisis response team are co-responders inside of the jail, much like the STAR team on the streets. They respond and work with people who have mental health conditions in our facilities, and we're very happy to be able to continue to do that work. Madam Chair, I'll pause there to answer any questions.
Thanks. So the short story is these are positions that are already open. We're just holding them, continuing to hold them open. And you've already got what you feel like is a sufficient contingent of mental health resources and support for folks in your custody.
Yes, ma'am. We look forward to when the budget is more plentiful across the city and we're able to add additional personnel because the work has been great to have those CRT clinicians working side by side with the deputies.
Thanks. Perhaps it's worth mentioning that your department pays a significant amount in overtime due to understaffing on the deputy side, and the budget relief could come in another way, perhaps, if you were at complete staffing levels. So, okay, another question for you, and if other board members have questions, feel free to raise your hands. I happened to read an article recently that the evictions in Denver are 75% higher than they were in 2019, and that we are on track for a record number of evictions this year. I know that the department has a role in the eviction process, and just wondered if you could reflect on that. Why is that so much higher? Obviously, housing prices likely has something to do with it, but I know the city's also invested a lot in eviction prevention, and so it seems like that's either not working or it's insufficient. But sort of what role are you playing in that?
Our role is to execute the orders that are issued by the court, and we do everything that we can to assist the families that are unfortunately facing eviction. The deputies that are performing those duties work on the streets and are going to those residents are handpicked because of their heart for the community. They lead with their humanity. I can tell you that I've had a lot of people who have personally called me to share that information. So our role is specifically to execute those orders. There have been a lot of stories about why evictions have been increasing. Certainly feel for all of the families. When I was in the 9th grade, I was actually evicted by the Denver Sheriff's Department. The Denver Sheriff's Department stood by while that eviction was performed, and the deputy that did that treated my family with a lot of heart and humanity, and I never forgot that. So it's very important for us to be able to sympathize and empathize with folks that are in that situation. And we certainly hope that things can get better for all of those families going forward.
So is there anything programmatically that the Sheriff's Department is perhaps working on with the city, or city partners to help reduce evictions? I understand your role is primarily to oversee the actions once they've already been determined, but seems like this problem is getting much worse, not better, and just wondering sort of programmatically what can be done about that.
We do attempt to help those families by pointing them to the resources that are available through the city. Through Denver Human Services. So the city also has an eviction defense fund. I know the mayor has been in support of that, as has city council. And so our role, even though it's primarily to stand by for those evictions, is to work to try to help those families to find resources prior to that eviction, and to ensure that they know of those services that are available through the city and through community partners as well, to provide them some additional help during that very tough time. Mr. Hernandez, I see he has a question as well.
Yes, thank you. I wanted to go back to a previous question relating to the mental health positions that you're holding. How many mental health positions do you have in total? And are they fully staffed, those that you aren't holding, but that you have available? What do you have?
On the crisis response team, I'll have to get the exact number. I believe it was 11 currently approved, 6 currently in place, and then we were going for some additional expansions. But I can get the exact numbers. I'm trying to remember off the top of my head if those numbers are correct. But we certainly are looking to continue to grow those numbers.
So about half of the total positions you have in place.
That's correct. But I'll tell you, we look to hire folks that want to work in this environment, which is extremely challenging. This is hard work, not just for the deputies, but also for the professional staff that work beside them. And it takes a very caring person, but also somebody that is willing to work in an environment like ours. So it's been a challenge, but we certainly are continuing to try to find the right people to do the work.
Got it. Thank you.
Madam Chair, I wanted to pivot back to make sure that I answered the previous question completely as well.
Yeah, I think it's probably a much longer conversation, but helpful to sort of get the tenor here. Do board members have other questions for the sheriff at this time?
I'd also like to recognize Nicole Taylor, who was also at our graduation on Friday. She takes good care of Monitor Castle, making sure she gets to where she needs to go.
And I think that graduation happened on our campus at DU, so appreciate hosting you there, and of course, welcome anytime. Any other questions for the sheriff? If none, I will turn it over to Monitor Castle. Do you have anything to cover in the public forum?
No, ma'am. Thank you.
Okay. Daniel, is there any additional board business that we need to cover?
There is one. You had announced earlier that the event, 20th anniversary event that we were planning for October 4th is going to be postponed. We have a board meeting scheduled for October 4th that we were planning to cancel due to that event. If that event is being postponed, we have the opportunity as a board to discuss whether or not we want to reinstate that board meeting and what we would like to do with it. Yeah.
My suggestion is that we engage with our strategic planning resource and see if they might leverage that date for any additional board engagement as part of their process. So if board members feel comfortable with that approach, that would be my suggestion. I see a nod from David. Rufina, any feelings on that? Go ahead, Sheriff.
Madam Chair, not sure if you all still need me.
Oh, no, go ahead. Sorry. Thank you so much for your time.
All right. Good to see you all. Thank you. Have a good Friday.
Thank you. See you soon.
All right. Bye-bye.
All right. Okay. So if folks feel okay with that approach, we can hold the time, see if our consultants potentially want to use that time for any board engagement early in the process. And if not, we can give folks some time back.
I think that's a great idea.
Okay, great. Monitor Castle, go ahead.
Yeah, just to be clear, so you're not planning a COB meeting where we would attend? I can
Likely not.
Okay.
Mm-hmm. Okay, great.
Would the board want to meet in person for that? Plan to meet in person on the 4th?
I would think so, if that's sort of the process that the consultant wants to use. So let's check in with them and see if that goes with what they're hoping for, and then if not, we'll give folks time back, but plan for an in-person discussion. Okay, with that, if there are no other comments or items of discussion from the board members, I will close out this meeting and thank everyone for their time today. Appreciate it and see you soon.